March 13, 2020 holds a vivid memory for most Kenyans.
I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
The health CS Mutahi Kagwe announced news of the first coronavirus patient who had traveled to Kenya from US through the UK on March 5th. Since then, the number of cases continues rising steadily, and this has commendably left certain sections of the population at an increased risk of contracting the virus. Early this year, the World Health Organization confirmed that a novel coronavirus caused a respiratory illness in a cluster of people in which was reported to the organization on 31st December 2019 originated from Wuhan City, Hubei Province, China. Regrettably, it was here with us. The virus could be transmitted from person to person after close contact through respiratory droplets, mainly when they sneeze or cough. The disease could also be transmitted from surfaces or objects used by an infected person. Therefore, this called for unsurpassed hygiene amongst the public by regularly washing their hands with water and soap, or alternatively, using alcohol-based sanitizers to kill viruses on their hands. Maintaining at least 1 meter distance between people was paramount to avoid contracting respiratory droplets released by someone when they sneeze or cough, amongst other strategies laid down by the World Health Organization. Ideally, this meant governments would step up their way of controlling their borders to avoid an unmatched spread of the disease either within or across the borders. Luckily, there was room for recovery, which built hope amongst the citizens on pushing forward the fight against the virus, since Kenya announced its first coronavirus recovery on 25th of March. In response to the gradual rise of coronavirus cases in Kenya, the government closed all schools and directed that all public and private sector workers work from home. Travel restrictions were later imposed to prevent non-residents from entry. Kenyan nationals and residents were required to self-quarantine for a minimum of 14 days. The Health Minister Mutahi Kagwe banned all social gatherings, including religious. The 7 p.m. to 5 a.m. curfew was announced by the president on the same date. This posed as a knockback to citizens, but typically it was for the safety of everyone against the disease. It was now official, the fight against COVID-19 had just commenced. With these enacted restrictions, it simply made it hard for most Kenyans who survive on a hand-to-mouth source of income basis. Therefore, the government had to turn up on reaching the adequate needs of their citizens amidst the pandemic. The government established a support program with the resources drawn from recovered proceeds of corruption and the well-wishers' donations through the COVID-19 fund. Uhuru said all donations towards the hardest hit by the pandemic should be done in a coordinated way through the fund. They identified the vulnerable groups in the system and consistently worked on inoculating aids towards them. They included the elderly, those living with disabilities, widows and widowers, the displaced, refugees, orphans and the congested, pregnant women and children amongst others. They obtained mobile numbers of the targeted households and had their stipends sent via mobile money cash transfer service platforms. Study carried out showed that these people with a budget of 4,000 Kenyan shillings a month, they could afford a basic livelihood, not absolute comfort, but basic livelihood. On top of the already disbursed funds, early April this year, the president approved the use of another 10 billion shillings to cushion the vulnerable following reduced activity in the wake of the coronavirus pandemic.
The appropriation of an additional Kenya shillings 10 billion to the elderly, orphans, and other vulnerable members of our society through cash transfers by the Ministry of Labor and Social Protection to cushion them from the adverse economic effects of COVID-19.
He warned against needless delays and frustrations in the release of these funds, hoping to strive to improve and expedite the ability in assisting those in need of the funds. In this feature, we shall visit various sub-counties of Kakamega County to establish if the funds set for the vulnerable were decorously disbursed. These are the vulnerable. My name is Tom Cliff Makanga. First and foremost, we ought to establish what exactly is coronavirus. Sol Amanya, a community extension health worker, Shinyalu Sub-County, takes us through the essential facts we need to equip.
COVID-19 is a viral infection and is fairly new because it has not been there before. This is a zoonotic disease. Zoonotic means it is transmitted from animals to man. So the virus which causes COVID-19 has been, it's coronavirus. It has been a common virus within wild animals, especially so the pangolin. And this particular virus has a nature, and when it is in the animals, it doesn't affect them. And so when it crossed over and came into man, because of the interaction of man with the wild animals, you find viruses have a nature of mutating whenever they go to a new environment. Or, for example, when a virus was infecting a particular person and then it goes to another person, it changes form. So because of the character of mutating, we find this virus is seen to have mutated from the original state, and now it is causing disease, which is the COVID-19. That is coronavirus diseases. It's an acute respiratory infection that affects men, and it is acute because it is similar to the previous diseases like SARS and so on. But then this one has a particular characteristic because it's acute. When it affects somebody, it has got, its virulence level has been so high compared to other diseases. We have other respiratory infections that we know commonly. We call them here homa. Homa can be in various forms. We have common cold, which you cough a bit and then within maybe 1 week it goes away. But then COVID-19 has had a characteristic whereby it goes into the human breathing system, the respiratory system, and then lodges into the lungs, and it prevents the normal function of the lungs, and then it is able now to cause disease. And whatever we have heard through the reports, it affects even many other organs. So that's why we are so much concerned about it.
An incident recorded in the same county witnessed individuals consuming alcohol-based sanitizers who thought they could achieve the plain alcohol effect. Mr. Amanya takes us through the dangers of ingesting the sanitizers.
Now, sanitizers are used for external surfaces. External includes the skin and other hard surfaces where we know. But then when you are talking about treatment, you're talking about internal organs. Internal organs use microchemicals which go into the tissues, and they address the problem, especially so by one, acting on the infection levels within, and then those chemical compounds go and combat that particular bacteria or virus within. But then they also, like viruses, we know there's no particular treatment. But then viruses, we use what we call body defense mechanism, whereby you raise the body, the antibodies within the body, and those antibodies are the ones which are likely to fight the virus within the body. So when the body defense mechanism has been aided, because when you treat, you are treating alternative infections which come as a result of a weakened body system. So viruses weaken the body defense mechanism. But then sanitizer cannot be used inside the body because they will kill the body tissues.
Despite an extensive research by scientists and medics across the globe, the World Health Organization is yet to establish a cure so far. With this at stake, it openly poses as a danger to the vulnerable, as witnessed in Navajo sub-county.
In the current situation where we have very erratic climatic conditions, we have now floods all over East Africa. And our area here in Kakamega, we are affected because we have seen the case of Nzoia River, where the families that stay near the river are experiencing floods. Now, floods have a character that when they come, all the people who are within its reach are displaced. Now, when you displace people who have been in their homes and they don't have homes, they have to migrate to another ground which is higher so that they cannot be affected by floods. You are saying in essence that their lives have been altered to a great extent. They don't have homes, they don't have the ease of their families wherever they are, and therefore when they move to particular regions where they perceive to be safe, they are likely to overcrowd. A case in point is Sikubale in Bunyala here. You know, when those people were affected by floods, they had to move to Sikubale Primary School, which is a safer ground now compared to the areas where they live near riverbanks. Now, such people are likely to overcrowd within classrooms in that particular area. So you are talking about populations along the river Nzoia, all along up to Bodalangi and so on. So when you find people overcrowding because of this, they are likely to go into uncharted territories, like avoiding overcrowding and so on. They will now crowd together because what is of value here is survival. It's not about the convenience of somebody being maybe in a safe environment or so.
Right on the riverbanks of River Nzoia, we meet Julius Mukani's family, a resident of Sikubale. He is amongst residents coarsely displaced by floods after River Nzoia broke its banks due to heavy rains experienced in the region. The effects of the ill-fated floods are pliably portrayed as some of the roads leading to Sikubale are practically impassable. Fields and crops were merely spared by Mother Nature, as most of the farms remain bare. Luckily for them, residents sought a temporary shelter at Sikubale Primary School until the water level would go down. CS Devolution Eugene Wamalwa, Wycliffe Ambetsa Oparanya, Governor Kakamega County, and Sospita Ojaamong, Governor Busia County, accompanied by other legislators, visited the devastating site to demonstrate their solidarity in standing with their people by promising relief food and provisional basic needs before they could resume normalcy. But according to residents, 2 weeks down the lane, by the time of this recording, they had not received any aids from the leaders.
County government vile walikuja walisema wataleta blanketi, mapati na vitu ya kuzuia corona. Kati walikuwa hapa tarehe 9 mpaka saa hii hatujawahi ona kitu chochote. Waliahidi kuleta ni mask na sabuni, mpaka saa hii hawajawahi onekana. Hata juzi watu wa county government walikuwa hapa, vile gavana alisema ati atatuleta mabati na kila kitu. Sasa baadaye wanasema ati tuchinunulie mabati na miti ya kujenga. Sasa pesa tutatoa wapi? Wakati wa corona hii tuko na shida, sababu tuko kwa shule kama familia 15 hivi, lakini tuko congested. Hatuna mask, hatuna sanitizer na sabuni. Sasa maisha ni ngumu, mahali pa kulala hatuna.
Chini Wamalo alikuja hapo Sikubale na mheshimiwa Oparanya. Ile siku ndio walitupea tu hiyo mchele kavu, hakuna kitu kingine chenye tumepewa. Tuliahidiwa tu tutapewa mapati, alafu tutakuwa tunapewa chakula, na mpaka wa leo hata malasi hatujaletewa pato. Hatujawahi pata pesa ambayo walisema watakuwa wanatuma kwa simu ili tuwe tukisaidia nayo. Kweli hapo ndani tumefinyana kabisa, hata kujizuia, kwa sababu unaweza wewe unajaribu kufanya usafi, unanawa mikono, unajikinga, unavalia hiyo maski, lakini sasa hiyo kusukumana huku na huku una hatari hapo.
Mkani's plea to both governments.
Sasa tunaomba serikali itusaidie. Kama mimi kivyangu binafsi niko na watoto 4 kwa secondary, watoto 4 kwa vyuo vikuu na wengine 2 kwa primary, na mali yangu yote ilienda. Sasa nataka serikali inisaidie, hata inihamishe hapa wanunulie mahali pengine, sababu kila mwaka huwa nasumbuliwa na maji.
People living with disabilities are among the vulnerable. We encounter Anne Hassamulanga at her home in Itenyi, Mulanda location, Kakamega East Sub-County. Hassamulanga suffers a collapsed spinal cord that rendered her physically disabled for the past 10 years, as she recounts. The condition deprived of her suppleness, leaving her upright for the better part of her day-to-day. Since she cannot sit on a wheelchair, she is left to move around by the help of a plastic chair. Her plea to well-wishers is to purchase for her standard crutches.
Wakati wa corona nimesikia kwamba serikali imetoa usaidizi. Na hiyo vitu vyote sijapata kama mlemavu. Watu wenye tuko na ulemavu tunaomba serikali tusaidie. Kwa sababu niko hata na watoto wanahitaji fees. Na sina vile niweza kupata watoto elimu yao.
We also encounter a similar condition in Shivakala, Kakamega East Sub-County. Meet Redemptor Shanyisa, a single mother of 2, twins to be precise, also living with disability for a better part of her life. A clear spectacle of utter poverty at first sight unfolds. According to her, coronavirus is not problematic provided she can provide food on the table for her daughters and elderly mother that solely depend on her. She complains of negligence from the government since she has not received their support as one of the many people living with disability.
Ni mlemavu. Niko na watoto wawili mapacha. Hata chakula sikuli. Sina wa kuishi. Niko tu na njaa. Niko tu na nyanya, ajiwezi. Ni mzee. Wakati wa corona sina usaidizi. Niko tu peke yangu. Hata watoto chakula sina. Hata kulala nalala tu chini, sina usaidizi. Sina hiyo mask. Sabuni ya kunawa mikono sina. Nakaa tu, sina usaidizi. Nasikia president anapeana pesa ya walemavu. Mimi siko naku pesa ya walemavu. Niko tu hapo.
As stated earlier on, the government has put in place measures to see to it that these people are catered for. The question is, who is benefiting? Barthes Wetuli, chairperson for the disabled Navakolo Sub-County, takes us through how the disabled are supposed to benefit from the funds.
Kama sisi walemavu, tunashukuru rais kwa kutoa pesa za kusaidia walemavu. Ingawaje hizo pesa zilitolewa, lakini walemavu tuko wengi kwa sababu hizo pesa walichanganya kwa makundi tofauti, wajane, wazee, walemavu. Kwa hivyo tunaomba rais ama serikali kwa jumla iongeze kitinda cha pesa kwa upande wa walemavu, kwa sababu wengi waliwachwa nje na maisha yao imekuwa ngumu. Kama sisi viongozi wa walemavu, mimi nashukuru TCC wetu hapa na Navakolo wakati waliweka assistant chief na chiefs kuchukua zile data kwa wale watu ambao wajiwezi, na nilienda nikaangalia nikaona walemavu kata walikuwa ndani, lakini walemavu wengi waliwachwa nje kutokana na uchache wa zile hela ambazo zilitolewa.
His appeal to both governments is urging them to put actions to see that every other person living with disabilities is reached. He also appealed to donors giving out reliefs. They should also remember the disabled during this period of the COVID-19 pandemic.
Tunaona watu wengi wanasunguka na misaada, ati wanasaidia watu gani, lakini sisi walemavu tumesaulika. Kwa hivyo tunataka wale wahisani ambao wanajitokeza pia wakumbuke ya kwamba walemavu tupo, kwa sababu pia sisi tuko na changamoto kadha wa kadha.
The elderly are also a targeted group amongst the vulnerable. A good number of the elderly within the county have every reason to beam since some of them receive their monthly stipend under the Ministry of Labor and Social Protection Inua Jamii Cash Transfer Program, though a majority of them are appealing for a monthly stipend of 2,000 shillings instead of an accumulated 8,000 shillings.
Wakati mimi mwenyewe niko na miaka 75. Nataka kuonara ianze mwezi ya 3. Sisi wazee zile pesa walisema tukipata 2,000 kila mwezi. Lakini wao wanachukua miezi 4 ndio wanatulipa. Sasa tunasema hii wazee na wakati ya ugonjwa hii maisha yetu huwa tufanye namna gani? Na kwa nini wanasema usitembee? Usipotembea utakula namna gani? Na wazee tufanye kazi. Ile mimi naomba tu serikali iweke mkazo kwa hiyo ugonjwa wa korona na tena wakumbuke wazee. Tuwe tukipata pesa 2,000 kila mwezi kuliko kuchukua miezi 4.
Speaking to Lubao's Assistant Chief Shinyalu Constituency, Sulvey Ashono, she believes the accumulated amount of the stipend is better compared to the monthly 2,000 shillings.
Kuna pesa ambazo au wazee wenye walikuwa wameshaandikishwa tayari wameshapata pesa zao za COVID-19. Walipewa, kila mtu alipokea shilingi 8,000 na kuna wengine ambao wako wameandikishwa na wale ambao wako vulnerable kabisa. Tumeandikisha majina yao na majina yameshaenda, bado tunaongojea ili wapate pesa zao. Ni vizuri hata vile wanakaa miezi 3 na at least wanawapatia pesa yenye inaweza wasaidia wafanyie kitu ya maana. Wanaweza anzisha kitu kama biashara, lakini sasa ukipewa kila mwezi 2,000 haina maana. Fadhali accumulate kama miezi 3 itakusaidia.
Expectant mothers and children under the age of 5 are also another vulnerable group exposed to the dangers of COVID-19, according to Mr. Amanya. As he explains, the county government of Kakamega has put in place measures to see to it that these groups of people are not abandoned.
Pregnant mothers, we are capturing data which includes, like, we work through the community units. A community unit is equivalent to a sub-location. So a community unit, like here, we have several. In Shinyalu we have several, like here in Sukanot we have Buyangu, we have Lubao, we have Ibakale, and we have Ingolomosio, and others. They are spread all over. So each community unit has about 10 community health volunteers. These community health volunteers oversee households within that particular village, and they capture data on this particular form, which captures the name of the village. It captures also the name and contact of the ANC client, that is the mother. And then we also expect that these particular pregnant mothers are linked to a particular facility which offers antenatal care services. Now, like we have here Shikusa, we have Buyangu dispensary, and then we have others spread all over Kakamega County. Then we also capture the age of the person. Because we are likely to get teenage pregnancies in this particular period. So we capture that data and the age. We shall document also the age. We capture all details about the antenatal mothers, like the last monthly period, the expected date of delivery, the ANC visits. We expect that ANC visits per every pregnant mother are supposed to be at least 4 in every pregnancy. So from the time they start up to the time they end the antenatal clinics, there are supposed to be 4 visits in the designated facility, and then at the end of it, they are supposed to be linked to. They are encouraged to have an individual birth plan where they will deliver from. And so this time we are capturing so that in these days of curfew, somebody can start the name. They are known as birth pains. They can start having birth pains at night. So how do you transit from the village level, and it is curfew time, to a facility where they can deliver safely? Because we expect that all of them deliver through skilled workers.
But what if an expectant mother was to go into labor in the late hours of the night, considering the curfew period enacted by the government? Speaking to Peter Mwanzo, OCPD Malava, Kakamega North Sub-County, he reassures boda operators safety as they transit the mothers to and back from hospital.
Watu wa bodaboda pia walikuwa na mauoga kwamba wakibeba hawa wagonjwa wanaogopa jinsi watakavyorudi manyumbani kwao kama ni masaa ya usiku. Lakini tulikuja tukaketi chini kama sub-county security team, kamati ya usalama katika hii sub-county, ambapo tulizungumza tulipopata hayo malalamishi kutoka kwa MOH kwamba kuna upungufu wa wagonjwa. Tukaketi tukasema na watu wale wanaleta wagonjwa kwa hospitali, polisi sisi wataruhusu wafike kwa hospitali, na baada ya wakishaleta huyo mgonjwa, baadaye kabla hajatoka kwa hospitali anapatiwa kabarua kadogo ambapo katakuwa na muhuri wa hospitali kuonyeshana kwamba yeye alikuwa analete mgonjwa kwa hospitali, na akishamaliza anarudi kwake nyumbani. Na hako karatasi tuliagana katika kamati yetu ya usalama kwamba katakuwa tu valid kwa masaa 2 peke yake.
Trade persons across the county are giving their outcry condemning negligence from both national and county governments during the corona period, since it's hard for them to meet the daily needs considering the newly imposed laws in their sector.
Naitwa Stafford Kamau, nafanya biashara hapa Kakamega Bus Park. tunauza nguo mpya. Sasa kuhusu hii maneno ya COVID-19 bana, tunaumia sana juu kuna vitu hatupati kama mask hatujapewa na gava. Maji tunajitotea sisi wenyewe ya kunawa. Sanitizer sisi wenyewe ndio tunabai. Unaona sasa tunashangana, kuna pesa imetoka ya serikali na sijui hata haitufikii sisi. Sasa tunaomba tu kama gava inaweza ingilia kati, itusaidie sisi watu wafanye biashara. At least tupate mask, tupate maji, tupate sanitizer, at least tungangane na hii hali.
Mimi ni mfanyabiashara hapa Main Market, nauza viatu. Na tangu hii mambo ya corona iingie tumekuwa na shida kubwa sana. Hasa upande wa biashara imerudi chini. Hakuna pesa na tena barakoa. Tunaambiwa tununue barakoa, kila mtu awe na barakoa. Na barakoa zenyewe gava inafaa itupe na hatuzioni. Sasa sanitizer hakuna. Sasa maji inabidi tutafute maji na vibuyu sisi wenyewe ndio tuweze kunawa. Tuko na shida kubwa. Serikali haitusaidii. Tungependa kuomba serikali itusaidie. Hasa tuletee barakoa, tuvae barakoa, at least hata vile tumenunua moja watupe ingine tunaweza change.
The same ill-fated message of turmoil is shown by boda operators from Navakholo sub-county who also seem to lack faith in the numbers of positive cases of COVID-19 in the country released by the Ministry of Health, claiming there is a hidden agenda.
Mimi ni boda wa Mwembetosha hapa. Serikali mambo na COVID-19, serikali ya national na county sinajidai kwamba zinatumia pesa mingi kutumia kwa mambo ya COVID-19. Watu wa boda hatutafaidika popote na hii pesa yao. MP tu peke yake ndio alituletea mtungi wa kunawa, tunamshukuru, lakini tutanawa na tutakula nini? Sisi huku tunaendeshaka pikipiki ndio tupate chakula cha kila siku, lakini ukienda kwa barabara mnafukusana na maaskari, mara wapi nini, umenawa wapi, wanakuuliza maswali ya kilini. Sasa sisi tunauliza hizo pesa zenu zitafika huku lini?
Sana. Mimi kama mtu wa chini niko na shida yangu ni kwamba enyewe iko pesa yenyewe imekuja. Najua pesa iko hapa. Lakini ni kama hii pesa imekuja kwa biashara. Imekuja kwa biashara kwa watu wenye wako kiwango ya juu. Sababu hii pesa vile imefika, mimi najua mtu wa Navakholo inafaa afaidike kwa hiyo pesa. Lakini mpaka saa hii sisi hatujui pesa iko ama hakuna. Sababu niseme hivyo, hata saa hii niko hivi. Kuna watu wanatoka saa hii kushikwa hapa Navakholo, wameenda station wametoa shilingi 2,000 ndio wakatoka. Sababu gani? Hata hii mask vile mimi niko hivi, siwezi kujimudu kupata ni mask. Sababu gani? Kazi yangu ya pota saa hii haiwezi lisha mimi niwe mask, niwe siki mambo hii sabuni ya sanitary siwezi. Sababu gani? Majukumu yamekuwa saiti na kazi ya pikipiki imekuwa kidogo sana. Jua hii maneno iko business, biashara inafanyika. Hata hiyo tati yenye wanasema watu wamefika skimu 700, hiyo ni uongo wao utupu kabisa, ni pesa wanatumia. Na hiyo ndio nimesema.
COVID-19 is escalating existing inequalities for women and girls and discrimination of already marginalized groups, including orphans, people with disabilities, the elderly, and those in extreme poverty. These people are at the greatest risk of being negatively affected by COVID-19, as evidenced by lessons from past epidemics. The consequences of the pandemic have caused the closure of formal and informal work, leading to a loss of income, which can lead to families turning to negative coping strategies to bring in money or reduce the cost of living. Young people are affected by the closure of social spaces, including schools and community centers, where they receive comprehensive essential services. The president admitted that due to the coronavirus pandemic, it will not be business as usual. Kazi Mtaani is also among Huru's initiative to help the youth earn a daily wage. As Kenyans work to flatten the corona curve, the president called for concerted effort to flatten the joblessness curve. Despite the various disbursements across the country, citizens have been lacking faith in expenditure of the money, raising eyebrows on the controversial report presented by Health Secretary Mutahi Kagwe to Parliament. The report was a breakdown of how 1.3 billion Kenyan shillings, mostly donated by the World Bank, was used in the fight against the coronavirus pandemic. What caught the attention of the parliamentary committee and Kenyans at large was the cost of some of the items procured or leased. All in all, It's our responsibility as a country to take care of the vulnerable and mitigate the spread of the disease across the country by following the guidelines laid down for our own good, by washing our hands regularly with water and soap, use alcohol-based sanitizers to sanitize, wear masks when in public, avoid close contact with infected persons, and maintain a 1 meter distance away from one another. Our health begins with me and you. Together, let's fight Corona. My name is Tom Cliff Makanga.